Hi, I'm Dr. Joe, and now I will be showing you the bridging technique for the nasolabial folds and marionette lines. So the way it works is that with very small amounts of product, we're going to produce quite a significant results for these areas. We already can see that the nasolabial fold is a lot softer since we already lifted the cheeks. We already did some zygomatic arch and eminence and flinch point injections to produce that lift. So it's all the way up into the scalp actually with the cannula. And now we're going to just icing on the cake, especially for the marionette line. So we'll actually start there. Well, I like start always at the top because you usually need less when you start at the top. So we'll first do the nasolabial fold. What's left of it reaches from here to here. And from here to here. Actually, this bridging one only requires about 2. Okay, let's go ahead and do 3. 1, 2, 3. I'm going to use a 27 gauge cannula here. And I'm using bilateral volume. And cleanse, cleanse, cleanse again. So here, I want to go that way. Not up or down, just towards it. I'm going to be level 2. And the best way to stay at that level in this particular area is with the cannula that's quite thin, like a 27 or probably at the most a 25 is what I would use here. Because if you try and get in there with the 22, it's a bit too thick. And when I did it on a cadaver, you could see that the cannula would just try and go down as it follows the path of less resistance. So you have to really be careful that you're not tricking yourself thinking you are in the right place when you're not. So you have to make sure you can really see it. And there's a lot more visual confirmation from using a really thin cannula. Level up. Level 2. And it was quite thin, so you have to kind of push it in like a dart. Okay? And a little pinch just here. You okay there?
Yep.
And you're going to just do retrograde from here to here. That's it. And I go back, and the path again. Watch the hold. And I had to go back because I can't stay there. If I try and stay there, it's going to tether. If I just try and move across, you can't. Okay, another little line. And one more. You okay?
Yeah.
You can see it. You can feel it. You can feel the tip. It's really superficial. Level 2. Okay. So that's it for the nasolabial fold. I'll do the same for the marionette line with the cannula and bridging technique, and then I'll move on to the other side. Ready? Now here I know that about 13 millimeters from the oral commissure is going to be the facial artery. So I want to try and